I had surgery, and it wasn't really the way I had originally planned on having kids. I mean, I think when you think about getting pregnant before you have kids, you don't fantasize about having a surgery, you just fantasize about having your kid and going home with them, and life's all happy and great.
I was aware of VBAC because when I gave birth to my first daughter, that was something right away in my aftercare that I was already asking questions about. Is this going to allow me the potential to still have the experience, the vaginal birth experience? And I was told, due to the risks and the uterus rupturing, that was something that was discouraged.
So with my fourth baby, this was my VBAC attempt after 3 cesarean sections.
In the early days during my third pregnancy, when we were trying to figure out what to do, my husband was really anxious about me possibly attempting a VBAC instead of having a C-section. And I think a lot of his anxiety, and some of that I probably shared also, was due to just some of the misconceptions that are out there in the public.
And I allowed the fear to be in the driver's seat versus being more educated about it. And then it was about 29 weeks. I thought, you know what, I've got to get a second opinion. And she actually recommended, she knew Dr. Stroud had done VBAC, so she recommended Dr. Stroud. And I came, and he just blew me away.
So when I went in for my first appointment and my husband was with me, I was really surprised when Dr. Stroud came in. He was like, hey, so you want to deliver the natural way if you can. Like, he was just, from the very beginning, very open to the idea, and yeah, just really informative, and we talked about all the different scenarios, and he was just great.
And he spent a half an hour with me, and right away he set the stage of optimism, comfort, love, and caring, and that this was truly, he invested in me as not a patient, but as a mother and as a woman who very much, he embraced the right to have as natural of a birth as possible. And he wanted to be a part of that experience. He made me feel almost like it was a privilege to be able to be a part of that experience.
The process of having the VBAC with my last child after having 2 C-sections, it was just a completely different experience, like night and day.
Dr. Stroud was out of town, so I ended up actually having Dr. Martin, which was another true blessing. And I had not met her. So I was really nervous when I heard about that, because then it almost seemed like when I went into labor, my fear came back a bit about, I wanted the expert to do my VBAC, and he was the one that I put all my trust in, and now there's a new doctor that I don't even know. She came in, and it was a replica of Dr. Stroud, the exact same approach. She was so loving and caring, and very much about embracing, letting a woman let the body determine when you're going to give birth.
And this was for the first time somebody not telling me what I needed and what was going to happen. It was a collaborative, and I can't stress that enough. It was a collaborative choice between myself and Dr. Stroud. That one of the best things for me at the time would be to proceed with an induction. And of course, I was apprehensive at first because, oh, here we go again, another induction. But this was different this time. This wasn't somebody telling me, your baby's too big, we need to induce, you're not going to do this, your pelvis is too small. This was somebody who genuinely had the interest of my baby at heart.
But he was, I mean, never once did I feel like he was pushing anything on me when I was going through the delivery process. He would come in, just see how I was doing, and just talk to me about the different options, and he was great. He was amazing.
He worked with me on this attempt at a vaginal birth and a VBAC, but he also wasn't doing so recklessly, so much that he was going to jeopardize the health of myself or my baby.
He's very competent. Like, he knows his stuff. When you sit down, you talk to him, and he just starts rattling on all this different research, and I mean, he's really, really, really competent and on top of stuff.
Having my family there was everything, because he was very much about allowing anybody who you would like as your support team. So I felt like I had an army versus 1 or 2 people, and that was really due to him. And to have that level of support, I knew I was going to do it. I was determined.
I'll never forget, I was 7 centimeters dilated, and he came in my room, and he looked at me, and he looked at the screen, and he looked at me again, and he said, you know, the baby just doesn't look like they're tolerating labor. And I knew that. And I said, you're right.
And my first birth experience, I mean, the doctor's there and the doctor's gone, and that's about it. And then she comes back once for a daily visit. Dr. Martin was hands-on, implemented the whole time. She was implementing her services and just her love and her heart. And she sat by my side, held my hand through every contraction, and she was just remarkable. And she did not leave until she absolutely was assured that I was comfortable.
Afterwards, I had a lot of people from the natural birth community. The first thing they wanted to say was, I am so sorry you did not have a vaginal birth. And I had to stop them and I had to correct them. And I said, no, I had an amazing birth. It was the attempt. It was somebody that was willing to give me a chance. The chance is all I wanted. All I wanted was a chance. And I had a C-section and I recovered beautifully from it.
I would very much like other patients to know is that they do have the option to have a vaginal birth after a cesarean. And it saddens me greatly to think that I was almost prevented to be able to have this experience based on a physician's fear or lack of education or a lack of research, the present research that's available. And due to that, I would hate to see that someone else not be able to have the same opportunity to know that door is fully open. And I would love more education to get out there and to really diffuse the fear that's out there and the stigma that's behind having a VBAC that can allow so many mothers and so many families to be able to experience such an amazing natural birth process that was the way it was meant to be.
It was all about the attempt and the chance. And if I'd had a vaginal birth, awesome. That would have been great. That, because that was what I was trying for. But it didn't happen that way, and that was okay too.
For other women out there that might be in similar circumstances where they've maybe already had a C-section or if they have had 2 C-sections and they're considering the possibility of having a VBAC, I would say if your doctor says you're a candidate and that's what you want to do in your heart is to have a VBAC, then go for it.